go.
Hi, this is Elizabeth Jones, and this is my respiratory assessment. My model here is Kevin. Kevin, do I have your permission to post this on the internet?
Yes.
Okay, wonderful. Alrighty. So, to start the exam, we would begin with observation. So what I'm observing is the anterior and the posterior of the chest. I am looking for any deformity. I'm looking at color, accessory muscle usage, retractions, and I am also assessing for color. We're hoping to see a pinkish color. I'm also going to check the nails for any clubbing, as well as any cyanosis, really any cyanosis anywhere on the body. All right, so we'll take a look at your anterior and check in your posterior. All right, everything looks good. So next in the exam, we move on to palpation. We're going to start with a test called respiratory excursion. And what we will do is we will place both of our hands underneath the rib cage and ask our patient to take a deep breath and then release it. As that happens, the hands should move back to where they started. And we do this anteriorly and posteriorly. All right. Take a deep breath in for me. Okay. Go ahead and exhale. Okay. And posteriorly. All right, take a deep breath for me. Okay, and exhale. Okay, great. The next test that we're going to do is called tactile fremitus, and essentially we are checking for symmetric vibrations on the chest. So we do this anteriorly and posteriorly, okay? So the technique, you can actually use one of two. The technique I'll be using is using the palmar surface of my hands. You can also use the ulnar side of your hands as well. It's just a matter of preference. All right. So Kevin, what I'm going to do is I'm going to place my hands on your chest, and when I do that, I would like you to say 99 for me, okay?
99. 99.
One more time.
99.
Okay, I'm going to repeat this on your back.
99.
All right.
99. 99.
Okay, perfect. You did great. All right. And so the last test for palpation is called costochondroid tenderness. So essentially what we are going to be doing is palpating the joint between the sternum and the ribs. And we do this on both sides of the chest. Ideally, there should be no tenderness or any pain. If you do experience any pain or tenderness while I'm doing this, just let me know. You can do it with your pointer finger or you can do it with your thumb. So I'm actually going to use my thumb. All right. Any pain or tenderness?
No.
no tenderness?
No.
Okay, great, perfect. All right, so next we're going to move on to percussion. And percussion is done in a ladder-like fashion. And the correct technique is to use your non-dominant middle finger, and then you're going to strike the first joint with your dominant finger. All right, so we'll go ahead and we'll get started. We're gonna check the anterior, and then we're also going to check posteriorly. All right. All right, now I'm going to move on to the back. Can you just shift a little bit like that there? That's perfect, thank you. Okay, what I'd like you to do for me is go ahead and cross your arms for me. There you go, perfect. All right, and we'll come around and we'll do the other side here. Okay, perfect. You can go ahead and you can put your arms down. So let's see. We did your front, we did your back, we did the sides. All right. So lastly, what we are going to do, oh, actually, you know what? Before we move on, we are going to check for diaphragmatic excursion. And what we do for that is, Kevin, I'm just going to have you turn sideways here for me. Perfect, thank you. So what we do for that is we start below the scapula, and the area below the scapula should be a resonant sound, but what we're going to do is palpate until we run into the dullness sound. All right, so we'll go ahead and start on this side here. Can you cross your arms again for me? Wonderful, thank you so much. All right. Okay, all right, you can put your arms down and you can have a seat right where you were. Okay, so that brings us to the last portion of the respiratory exam, and that's going to be the auscultation. So we will be auscultating anteriorly, posteriorly, and laterally as well. We also will be checking for checking the apices, which is the top of the lungs. So we're actually going to go ahead and start with that. All right, deep breath in, exhale. Once more. You can just breathe normally. Okay, we're gonna go ahead and repeat that here. Right. All right. I'm gonna ask you to go ahead and cross your arms again. Perfect. Perfect. You can go ahead and put your arms back down. All right. So the last test that we're going to do is called agophony. And what that entails is placing your stethoscope in the lung field and asking your patient to say E. What we want to hear is a soft, muffled E sound. If at any point we hear something that sounds like an A, that would indicate some consolidation, and that would be something that we would need to follow up further on. All right, so when I place my stethoscope, I want you to just go ahead and say E.
E.
Perfect.
E.
Perfect.
E. 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 E.
All right, everything sounds good. Thank you so much for your help, Kevin.